discuss about membranous nephropathy. Now, membranous nephropathy is a common cause of nephrotic syndrome in adults. It is the most common cause of nephrotic syndrome in adults. Now, the manifestations of nephrotic syndrome are mesoproteinuria, that is, proteinuria should be more than 3.5 grams, and then hypoalbuminemia. Because of such loss of protein in the urine, there is hypoalbuminemia. Generalized edema is there because there is serum protein is less, and there is hyperlipidemia and lipiduria because the body tries to produce more proteins and also produces lipids in that cycle. So this is the manifestations of all nephrotic syndrome. All the diseases which will be falling under nephrotic syndrome will have these manifestations. Now, going to the in the membranous nephropathy, we will discuss about the morphology, the pathogenesis, the clinical course. So before that, we should know the mostly the membranous nephropathy is idiopathic, okay, but there are some systemic associations with some drugs such as penicillamine, gold. Now these were earlier given for rheumatoid arthritis. The NSAIDs are also given for rheumatoid arthritis. Now these drugs, the penicillamine, gold, now are being discontinued because they are responsible for membranous nephropathy. Certain malignant tumors such as carcinoma of lung, colon, melanoma, these also can lead to membranous nephropathy. SLE can lead to many type of glomerulonephritis. In that, membranous nephropathy is also one of those. Some infections and certain autoimmune diseases such as thyroiditis. Okay, so all these are systemic associations of membranous nephropathy. Now going to the pathogenesis. So it is a type of immune complex disease. Okay, now this immune complex disease can be either the like in SLE. What happens in SLE is in the body itself there is antigen antibody complexes there which is forming immune complex. Now this immune complex goes and deposits itself in the glomerulus. So this is one way because of which there is membranous glomerulopathy. Second is if the antigen is directly present in the glomerulus. So sometimes the antigen can be exogenous such as hepatitis B, treponema. They can go and deposit in the glomerulus, and then antibodies will act against that antigen. But in some cases the antigen is endogenous also, that is certain renal antigens can lead to production of antibodies, and it is kind of autoimmune. So there is production of antibodies against the endogenous renal antigens, and therefore membranous glomerulopathy takes place. Now as we discussed that it is a type of immune complex mediated disease. Most of the idiopathic autoimmune diseases, they are linked to HLA, and there is antibody against the renal autoantigen. Now there is when we study the pathogenesis of all the glomerulonephritis, there is something known as Heymann's nephritis. Now what is the Heymann model? In Heymann's model, what was done is we induced glomerulonephritis in rat by immunizing the animals with the antigen which were containing some antigen from the proximal tubular brush border, and these rats then developed antibodies to these antigen, and the glomerulopathy which was developed was resembling to the membranous nephropathy. So because it resembles so much, the Heymann's nephritis resembles so much that the membranous nephropathy, so it is thought that the antibodies are produced against the renal autoantigen. So like Heymann's nephritis, it is considered that membranous glomerulopathy is also an autoimmune disease, and due to some susceptibility genes, that like some HLA predisposition, there is antibodies against a renal autoantigen, because of which the disease is there. Now why the glomerular capillary walls are so leaky? there is proteinuria. Okay, as we discussed that it is a nephrotic syndrome, there is proteinuria. But why they are so leaky? If we see the glomerulus, okay, it is not a hypercellular glomerulus. If you have seen my previous video, in case of post streptococcal glomerulonephritis, we discussed the glomerulus was a very hypercellular glomerulus. But here the glomerulus is not hypercellular, but that means there is paucity of neutrophils, monocytes and platelets. There is no such thing in glomeruli. But what is there? There is activation of the complement system. Now this complement system, if you remember, when the complement system at the end forms MAC, okay, the complex, complex. Now this complex is causing injury to the capillary wall, okay, and therefore there is increased protein leakage in case of membranous nephropathy. Now this was about the pathogenesis. Now going to the morphology. Now morphology, if you see the morphology, firstly the glomeruli, they are not hypercellular, okay, they do not have any leukocytes in them. There is just one thing, there is uniform diffuse thickening of the glomerular capillary wall. So if you see the glomerulus, okay, the basement membrane will be thickened of the glomerulus. So there is diffuse thickening of the glomerular capillary wall, and this is due to deposition of the deposits along the basement membrane. So if you see over here, this is the glomerulus, and you can see it is so pink. There is just deposition of the material in the basement membrane. Now prior to that, if you see immunofluorescence, because this is because of deposition of certain complements, immunoglobulins, immune complexes, the deposit will be granular rather than diffuse. Now on electron microscopy, before the electron microscopy, let me tell you about the silver stain. Now what happens is, because of the deposition, if you see these are the deposits, okay, what happens is the basement membrane is laid over here. So this is your normal glomerular basement membrane, and these are the deposits. So in between them there will be certain basement membrane material will be laid. Now this basement membrane material which is laid, it appears as spikes, okay, as spikes, and these spikes can be stained with the help of silver stain. So when we are doing a silver stain on case of this case, this is staining the basement material but not the deposits. These spikes are the basement membrane material, okay, and not the deposits. So basement membrane material is laid between the deposits, which appears as a spike, and further with time what happens, the spikes, they becomes very thickened and they join, okay, they form dome, and they just lead to a formation of thickened irregular membrane, and they will just bury the deposits inside. And on electron microscopy also, what you will see is irregular dense deposits of the immune complexes that will be seen. So this is the silver stain. On silver stain, what you will see, on the silver stain you will see the irregular spikes will be present. So what are the features if you see in case of membranous glomerulopathy? Firstly is the thickening of the glomerular basement membrane. Sometimes it's also known as duplication of the basement membrane. Then on immunofluorescence, granular deposits are there. On electron microscopy also deposits are present. Very important thing is to note that there is on the silver staining spikes are present, okay. Going to the clinical features. Now clinical features will be depending on the nephrotic syndrome, okay. The patient will present with nephrotic syndrome. Some patients can also present with hematuria and mild hypertension, but mostly patients will present with the nephrotic syndrome. Now the course of the disease is variable and generally indolent only, but with the disease progression, okay, on microscopy also, with the disease progression, what you will see is increased sclerosis of the glomeruli. So you can see features such as mesangial sclerosis, such as glomerular sclerosis, but this is on the later side, okay, not on the, so progression is associated with increased sclerosis of the glomeruli. There is increased serum creatinine and development of hypertension. But mostly patients do not go into renal failure. Only 10% of the persons, they will die because of renal failure. Okay, so the course is generally indolent. Okay. So this was all about the membranous glomerulopathy. Do like, share and subscribe to this channel if you like these type of videos. Thanks for watching.